So when Hamlet says to be or not to be, he's actually talking about whether or not he should live or die. Oh
Mr. Burge! Oh my god. Okay, call 911. 911.
We are on our way to a high school where we received a call for chest pain.
It could be an MI, so we're on our way, lights and sirens.
Hi, sir. What seems to be the problem?
My heart, my chest,
Your chest hurts?
it hurts.
Okay, sir, we're going to start taking your vitals and we're going to ask you a couple questions, okay? When we first arrived on scene, I automatically knew he was having a myocardial infarction. He was cool, pale, diaphoretic, and was complaining of chest, neck, and arm pain. We had to give him nitro as fast as possible, or else he would go into cardiac arrest.
Can I look in your airway real quick?
Okay.
Okay. Airway's clear, intact.
All right, Parker, can you set
How's
this
your
in?
breathing? Are you having a hard time
It's a
breathing?
little tough to breathe. It feels kind of tight.
Okay. Are you having any other symptoms?
It just hurts.
Okay. Sir, did this pain come out of nowhere or was it more gradual?
Felt pretty sharp.
Okay.
Kind of came out of nowhere.
Does anything make this pain better or worse?
No, it just hurts.
Okay. And would you describe this pain as sharp or more as a dull feeling?
It feels sharp.
Okay. On a scale of 1 to 10, how would you rate this pain, sir?
10 to 12.
Okay. And around what time did this pain start for you?
5 minutes ago.
5 minutes ago? Okay.
Is the pain moving you or is it just in your chest?
Maybe my arms? I don't know.
Your arm?
Okay.
Okay. We're gonna give you some oxygen at 10 liters per minute.
Once we're done assessing your vitals, sir, we will start giving you medicine.
I'm gonna check respiratory rate. Please, I'm gonna check your heart rate. Okay. Pulse of 125. Alright. I'm gonna call medical direction. Medical direction, we have a patient with severe chest pain, arm pain that radiates to the neck. We administered 10 liters of oxygen through non-rebreather mask, and we would like to administer 0.4 milligrams of nitroglycerin.
Alrighty, you're good to go.
Perfect.
All right, sir, we just received permission to give you this nitro. So, will you take these and put on your tongue, please? Thank you, sir. All right, now we're gonna wait with you and reassess you every 5 minutes, and then we'll get you transported to a hospital.
Thank you.
Of course. When we transported him, we treated him for shock and took him to the nearest hospital.
Get this sick clip. Yo, watch out for that rock, dude. Whoa! Whoa! Yo, call 911.
We're currently on the way to a residential area where a young child has been seen falling off a skateboard.
Bystanders report that he is currently unconscious, but we are on the way.
He's being moved on the side.
I'm gonna hold C-spine, possible neck injury. Alrighty, stop seizing.
Okay, stop seizing, moving back down, continue to hold the C-spine. Okay, I do see some bleeding on the back of his spine. So let's go ahead and do a cervical collar and suction the mouth.
Stabilize the neck.
You suction the airway, I'll continue to hold C-spine.
Got it?
Yeah.
Alright. Inserting, suctioning on the way out.
Okay.
Airway is cleared. Alright, we're going to begin our head to toe assessment.
When we had first arrived on scene and we were there for about 10 minutes, the patient had already seized 5 times, not regaining consciousness once. This is a very clear case of status epilepticus, where the patient fell off his skateboard, hit his head, and is now experiencing a brain bleed. Okay, we're going to perform a head to toe assessment. No bleeding or crepitus. Checking the chest.
I'm going to start taking these vitals.
Palpating the abdomen. Everything is normal. The normal limits.
Alright, heart rate is elevated. Checking respiratory rate.
Okay, we have an obvious open tibia fracture to the patient's right leg. We're gonna splint it.
Patient is seizing.
Okay,
Patient is
roll him
seizing.
on his side.
Lean over.
Patient still seizing. Roll back over, suction. Suctioning on the way out.
Airways clear.
Airways clear. The patient has seized about 5 times. This is suspected status epilepticus from when the patient fell and hit his head. Let's get him transported to the nearest hospital now.
"911, what's your emergency?"
Yes, hi. There's someone floating in the pond.
There's someone in the water, sir?
Yes, floating in the water.
What happened to them?
I don't know. I was just walking by and I saw him. I need help.
Okay, don't worry, sir. Help is on the way.
Please hurry. I don't know how long he's been there.
Could you please tell me your current location?
Okay, we're at Idlewild Park.
We had just been called to Idlewild Park for reports of a drowning.
Fire department has already rescued the patient from the water, and we are on the way to help support them.
Let's go check it out.
Taking over compression. 25, 26, 27, 28, 29, 30. Taking pulse. There's a pulse. The patient's breathing.
When we first arrived on scene, the patient was very obviously cyanotic and unresponsive. Unfortunately, the only thing that we could do was CPR and wait until ALS arrived.
The patient's regaining consciousness.
All right, Kayla, I need you to start vitals. Harper, could you please do a head-to-toe assessment? Hello, sir. Can you hear me?
Yep.
All right, sir. Sir, what's your name?
Cody,
Cody? Okay. Cody, are you feeling any pain right now?
chest kind of hurts.
Your chest hurts? Okay. Did this come out of nowhere?
No,
No? Okay. Does anything make this pain better or worse?
no.
No? Okay. How'd you, is it like a sharp pain?
Yeah,
Sharp pain. Okay. Does, how would you, 1 to 10, how would you rate your
4.
pain? A 4? What time did this pain start, sir?
Like 30 seconds ago.
That makes sense. We were just doing chest compressions. Okay, sir, do you have any allergies?
No,
No. Are you on any medications?
no,
Okay, do you have any past medical history?
no.
Okay, sir, what was the last thing you ate?
Spaghetti.
And, okay, what were you doing before you went into the pond?
Goose chased me into the lake and I can't swim.
You can't swim. Okay. We're going to check your vitals, sir. We're going to get you transported as fast as we can.
Okay, thank
911, what's your emergency?
Hello? My wife, she needs help. She's pregnant. She fell down.
Okay, sir. Are you with her right now?
I'm on my way home right now, but there's too much traffic.
Okay, sir. We're going to need your address.
Okay. Our address is 123.
We're en route to the residence of a 38-year-old pregnant female who tripped and fell in her kitchen.
There are concerns of abdominal trauma which can cause harm to the pregnancy.
We're on our way.
Thank God you're here. Can you tell me what's wrong? I fell. I'm pregnant and I fell.
Okay. Do you have any pain anywhere?
Yes, it just hurts all over. It's like a tearing pain.
Yeah. Do you have any other symptoms?
Some blood, I think. I think there's some bleeding.
Immediately upon arriving on scene to this patient, I could tell she was in severe pain. She was experiencing abdominal tearing pain and vaginal bleeding, a clear case of uterine rupture caused by trauma. Okay. Do you have any allergies?
No allergies.
Okay, we're just gonna take some vitals. Are you on any medication?
Just prenatal vitamin.
Okay. Have you ever been pregnant before?
Yes, I've had 3 before.
Okay. Can you tell me a little bit more about that?
I had 2 C-sections.
And what were you doing before this happened?
I was cooking,
Okay.
and I had some ice cream to eat.
Is there pain anywhere else?
No, just here, just really bad tearing pain.
Okay. Alrighty. Do you know what your name is?
Carly,
And do you know where you are?
at my house.
And do you know what month it is?
January. Oh, it hurts so bad.
So we're just gonna take a quick blood pressure. And was it super sudden? Did it just start hurting? when you
Yeah,
fell?
right when I fell, it just started hurting.
Okay. And about how long ago was that?
An hour.
Okay. Alrighty. Okay, we're gonna treat for shock. So I'm gonna have you lay down if that's okay.
Okay.
Okay, I'm just swing your legs. hospital as soon as possible.
Hey, ma'am, can you lift your head for me, please? Put this around you. Alright, there you go. I'm going
Thank you.
adjust it, and I'm going to do 6 liters of oxygen for you.
Alright, let's transport. The only thing we could really do for her was transport her immediately, treat her for shock, and be there for her emotionally.
Medical emergencies can occur at any moment, but lucky for you, we're there to respond to it. Thank you so much for watching this episode of Day Viewers. I love bloopers. Okay, you just high-fived the back of my hand.
Do you like that one?
Yeah, it's good.
It's okay. I forgot my lines. I can't. All right. But at the moment, especially with your hair,
I'm the culprit of the CPR massacre.
Oh, perfect.